Hello, Revere, and welcome to our new show, the Revere Veterans and Community. Hello, Massachusetts, and today we have a special guest. His name is John Sepulveda. Did I get it right, John?
You got it right.
Okay. John is a senior account manager at United Healthcare. So, John, tell us about your organization and what you do.
Well, first of all, good morning. Thank you for having me here, Morris.
It's a pleasure for you to come.
It's a pleasure to be here. I really appreciate the opportunity. My name is John Sepulveda. I work with United Healthcare Senior Care Options. And what I'm here to do this morning is to explain to the public in Revere and in the surrounding communities about this phenomenal program. What this program does is it's a program that offers people who are over 65 years of age and older and on Mass Health standard additional benefits at no cost. It's a Mass Health program. It's United Healthcare is contracted with Mass Health to provide this program for people. We're one of 5 companies in the state who is contracted with Mass Health to offer this. And what it does is it gives people an array of additional benefits on top of what they currently receive with Mass Health or Medicare. They could be also on Medicare. And their Part D prescription medication coverage at no cost to them. It's rated 3.5 stars from CMS on a 1 to 5 star basis. And these are just ratings that CMS gives all the plans that offer and the companies that offer this program. So basically what the program does, Morris, is it gives people additional benefits. Number one benefit is people have a copay when they go to the pharmacy and pick up their prescriptions. They have a copay of $1.15, $2.30, or $3.45. And this program has 0 copay. So the member would save that money on a monthly basis. Another big benefit is dental benefits. Mass Health currently covers people for 2 cleanings a year and emergency extractions, and this program would cover them if they need dentures, crowns, root canals, implants. They could get it at no cost. There's a transportation benefit, so people would get transportation. They get picked up at home, they get brought to their appointments. When they're done with their appointment, they get picked up at the appointment and brought back home at no cost. So these series of benefits are what this program is made up of, and it's how the members who are over 65 and on Mass Health can enjoy these benefits at no cost. It's a network, so they have to visit providers, doctors that are part of the United Healthcare network.
Oh, so you can't have your
You could. So here in Revere, for example, which is where the public are from, the network is vast. The Mass General, the Beth Israel, all these hospitals in the area are part of the network. So there's, you would check before enrolling to make sure that their doctors are part of the network. But it's a vast network in this area, so there's not too many issues with that. And the biggest issue I find when I'm out in the community and when I'm talking to people is that people don't know about the program. People are afraid of the program. They think it's too good to be true. They say, well, how can this be so good? And they're hesitant about it, and they don't have the information about it. But after you look at all the facts, it's a phenomenal program for the community.
Right, but you have to be on Mass Healthcare to begin with.
You have to be on Mass Health, and
right.
You have to be over 65 years of age.
And there's a certain income that you have to have.
Correct.
I mean, that you can find out by getting a hold of Mass Health.
Correct. Right. If the person is not already on Mass Health, they can call Mass Health. They can go online to mass.gov and apply online, or they can call Mass Health and find out what the requirements are to apply.
Right, John.
And if they're on Mass Health already, they'll know that they're on Mass Health. They have the blue Mass Health card, and they know that they're on Mass Health.
So, let's say I wanted to get onto this program here, the United Healthcare, how do I contact you, or who do I contact?
So you would contact, again, my name is John Sepulveda. You can call me at 617-852-8570. That's my direct line. And call me, leave me a voicemail message with your name and number, and I'll call you back and explain to you the programs and see if the program is a fit for you.
Right. Now, some seniors do have computers, or could they do it by email too?
They can send me an email, and hopefully the card will be up on the screen as well, but it's John, John, Sepulveda, Sepulveda, at UHC.com. It'll be easier if it's on the card, because the spelling is a tough one of the last name.
Right. Now, a lot of people, like I go to the hospital and I have a copay.
Yeah.
And you're telling me with Mass Health there is absolutely 0 copay?
So when a person has copay, when a person has Mass Health,
right,
they do not have a copay. What Mass Health does is when a person, I don't want to get too much into this, how this works, but basically when a person has Medicare and Mass Health, Medicare pays has part of the coverage, and Mass Health pays the rest. So when a person who's on Mass Health goes to the doctor, they don't have a copay. And if you have a copay, it means you do not have Mass Health. This program also does not have a copay, but what a person on Mass Health does have a copay when they go to the pharmacy to pick up their prescriptions.
Oh, I see.
So when they have that copay, this program has zero copay. So the person would say
gets the free medication.
Gets at no cost. Gets the
Right.
medication at no cost.
Now, John,
There's also over-the-counter medication. So products that people buy at the pharmacy, like pain medicine, cough medicine, ear drops, eye drops, vitamins, which could be expensive.
Very.
They have to pay for. With this program, they can also get at no cost.
Right.
So substantial savings on that as well.
Here's a question that I would like to ask you.
Yeah.
I'm on Medicare.
Yeah.
I have Part A, Part B.
Yeah.
To get onto this health program, United Health, do you have to have Part A and Part B?
No, you do not. You have to have Mass Health Standard. That's it. Some people have Part A and Part B, but if they do not have Part A and Part B, and they have Mass Health Standard, they're still eligible to enroll.
Oh, okay. That's what I want to know.
Yep.
What else would you like to tell us about the program?
well,
because there's plenty to talk
Yeah,
about.
oh, absolutely. I mean, I think it's again, the issue I find out in the community is that people are, one, afraid, or two, they don't really know about it. Now, here in the city of Revere, there's about 1,100 people who are eligible for this program, meaning they're over 65 years of age and they're already on Mass Health Standard. So they could enroll in this program. That's a large number of people, Morris. If you think about 1,100 people who could save money on their co-pays for their insurance, for their prescriptions, who can get their over-the-counter medication at no cost. Obviously the population over 65, dental is a huge benefit. Dentures, crowns, root canals, implants. These are procedures that are very expensive, and if a person doesn't have the means to pay for them, they're suffering. They're going through with pain. If they need dentures, they can't eat properly. They can get sick. It can lead to other things, and it could be a big cost. So this is a big help for people.
What about hearing aids, John?
It's also covered. Mass Health covers the hearing aids. This program also covers the hearing aids at no cost to the member.
Because hearing aids could be pretty expensive.
Pretty expensive, absolutely. Yeah,
Right.
Yeah, they're covered by they're covered as well.
And they cover the eyeglasses and everything.
Eyeglasses are covered, the routine vision exam a year, and the frames. The person who's on Mass Health for the eyeglasses, their benefit is $75 every 2 years for their frames. This program covers people for $130 every year, so they can get a little bit nicer frame. But it's covered as well.
And people that need, I don't know if this covers it, like walkers and things.
Walkers, any medical equipment that they need, it's also covered at no cost to them. They also have a care manager, which is really what the biggest part of this program is. And what this care manager does is it provides the member with assistance in obtaining services that they may need. So some people, depending on their health needs, some people need help, maybe somebody comes over the house and helps them maybe clean and cook, maybe do the laundry for them, do things.
Oh, you mean
like a personal care attendant, or they need some additional help depending on their health and what their health needs are. So what United Healthcare does is provides a care manager for the member, who works with the primary care doctor and the member to make sure that any services that the member may need, the member gets.
You mentioned something to me that a lot of people don't know, and very few people do it, that if they need transportation to go to a certain place, healthcare will provide that?
This program, yeah. So currently, somebody needs transportation. There's a the ride from the T. It's the popular one. But the issue with the ride from the T is that you have to pay. It's $6 round trip.
Right, three each way.
3 each way. So it's $6 round trip. It adds up. If you have to go to the doctor 3 times a week,
You're
$18
right.
a week. It adds up. This program provides a similar service. Right? It's a transportation where you call up, you make a reservation, they pick you up, they bring you to your appointment and back at home at no cost. So that same person that is paying $18 for the 3 visits a week to the appointment, now they're paying $0. They're saving that money. And nowadays, the state of our economy and our situation, you know, that money can go a long way to buy food, buy groceries. I mean, it's pay bills. I mean, we're in a very difficult, you know, situation now, and everybody is feeling the stress of, you know, the financial stress. So any little bit helps.
Here's something I would ask, like, let's say you're part of the healthcare.
Yeah.
You have an emergency,
Yeah.
and you can't wait for me to call you to get a ride, but I got to be rushed.
Oh, no, that's not, your ambulance is a difference. That's, you call 911. That doesn't change
Okay.
at all. This is for, you know, your appointment. So you have an appointment to go to. You know, you wouldn't call the ride also for an emergency. You call 911 and then they bring you to the hospital and they take care of you. This is more to get, you know, let's say you live here in Revere, right? And let's say you go to the
Mass
local
General.
hospital, you go to Mass General, and you have to go to Boston for a specialist. You have a dermatologist that you need to see, and he's in Mass General in Boston. You know, you either get a ride, somebody drives you in, they pay for parking, they deal with all that stuff, or you use the transportation. It doesn't cost you any money. They pick you up at home, they drop you off at the door.
That's
When
pretty
you're
good.
done, you call them up, send them, they pick you up at the door and drop you off on your doorstep. It's a pretty good service. It really
Right,
is.
so if it's a real emergency,
You call
911.
911. You always call 911 first, yeah, for emergencies.
Okay.
Yeah, this is just the transportation. Now, you can also use this, let's say you have a dentist appointment, you use the transportation for that. You have an eye exam, you use the transportation benefit for that. You have to go get your hearing aid, you use the transportation for that. You have to go pick up your prescriptions, you use the transportation for that.
When you speak about dental care, you're talking about, if, let's say a person needs an upper set of teeth or a lower set?
The dentures, those are called dentures, upper and lower.
Right, yeah.
Yeah.
That's taken care of?
The program covers them at no cost. Yeah. So they need to use providers that are part of the United Healthcare Network, meaning the person will get a provider directory, right? There'll be a list of dentists. Now we're talking about teeth, right? So
Right.
there'll be a list of dentists, and the person can choose any dentist that they want that's in that network. You call up, you make an appointment, they go and they'll see you, and the dentist will determine if you need upper dentures. They'll put them in for you. So really, it's a phenomenal program, Morris. I mean, it's amazing. And
So in other words, it covers almost every type of doctor, like a chiropractor or any...
Oh yeah, absolutely. Yeah. Acupuncture. People that use acupuncture, it also covers.
I didn't know that they still do that, acupuncture?
They do, and it's covered. Yeah. It's. I mean, it like I said, it's an amazing program. It really is. And the shame of it again is, and I don't want to be redundant, but it is the truth. It's that just people don't know about it. People are afraid. People get at home. They get mailings. You know, giving them the information about the program, and they don't. It's all right. Talk to them. It's too good to be true. That cannot possibly.
So in other words, take me for instance, let's say.
Yeah.
I'm a senior, I'm over 65, I get onto Mass Health, and once I'm on Mass Health, I get onto your program.
Yeah.
And with your program, I get all these benefits.
Yeah.
That's a good deal.
It's a very good deal.
Yep.
Phenomenal program. Yeah. And it's there to help seniors. The objective of this, people might be familiar with the PACE program.
Yep.
You know, have you heard about the PACE program?
I've heard about it, but I'm not familiar with it, though.
So the PACE program is a program that is also through Mass Health, and what the PACE program does is it provides all the services in one location. Usually, you know, it's in a building where people live, and everything is in that one location. The doctors come to that one location. The person is not really leaving that location where they live. SCO, Senior Care Options, it's known as SCO, it's a very similar program for people who are out in the community, who are living at home. And the objective of this program is really to help the person who wants to stay living at home, being out in the community. So they can choose to go to, you know, a dentist in Boston and the Mass General in Revere, and they can do both and, you know, still get around and have the transportation. So it's really meant for people that are out in the community and try to help them, because nobody really wants to go into a living facility, or, you know, they don't want to do that. They want to be at home and be independent as much as they can.
John, I'd like to ask you a hypothetical question, if I may.
Yeah.
You got a husband and wife. Let's say the wife gets a very low in Social Security.
Yeah.
The husband gets a good Social Security.
Yeah.
The husband would not qualify for Mass Health because he's getting, let's say, $2,000 a month social. But the wife is only getting, let's say, $400. Would there be a combined income, or the wife would qualify and the husband wouldn't?
I don't really get into that
Oh,
part
but,
of the...
but Mass Health does.
That's something that they do with Mass Health.
Okay.
I've come across people that I've enrolled that the husband is on it and the wife is not. but I don't
Oh.
know how they, how they file taxes and what they're, because I don't get into that at all. I enrolled them, I help them enroll once I confirm that they're over 65 and that they're on Mass Health standard.
Right. So in other words, if I'm to get onto your program, I got to go on and call Mass Health and get onto them first.
Right.
And then from there.
And then you come on to this.
us.
Right. Like, so if you, in your case, if you were going to call me up, first I would, make sure you're on Mass Health standard. Then I check, make sure you're 65, because you look, I don't know if you look 65. You look pretty young, so I don't know if I make sure you're over 65.
Well, you got me confused with my twin brother. He's
There
the
you
old looking one. Okay.
But yeah, I would check. I only check that they're over 65 and that they're on Mass Health standard.
Very
And
good.
that's the only requirement. And what I do is just you fill out a simple application, very easy to do, and you enroll. It's on open enrollment, ongoing open enrollment. So you enroll at any time you want. Also, you can try this out, and if you don't like it, you can cancel and disenroll.
And there's no penalty.
No, there's no payments, there's no premiums, there's no co-payments of any kind, and there's absolutely no penalty to it's a completely optional program.
I need a doctor.
Yeah.
I'm already on Mass Health now.
Yeah.
This takes care of it, right?
Yeah.
But also now I need a specialist, a real specialist, and they're expensive.
Yeah.
Is that still taken care of?
Covered. So as long as you go to a specialist that's in the network. So let's use here Revere as an example, right? Because a large number of the people, at least the people I kind of come in contact with, they go to Mass General in Revere. Mass General is part of the network. So let's say you live in Revere, you go to Mass General, on Ocean Ave for your primary care doctor. You see your doctor there, and your doctor says you need a specialist, whatever kind of specialist, and he's in Mass General in Boston. Just make the appointment to go with the specialist in Mass General in Boston, and you're covered in the program. Because Mass General is part of the network, so you don't have to do anything. You just make the appointment and go see the doctor.
And it doesn't make, like if a person has a pre-existing condition, doesn't mean he's not, he still can get on?
Absolutely. The only pre-existing condition that it's not allowed to enroll is somebody with end-stage renal disease. So somebody who's getting dialysis, they're not, and that's a Medicare rule. So if somebody has end-stage renal disease, they cannot enroll in this type of program. They have to stay in the program that they currently have, and they already have programs for that.
Okay, let's say a lot of elderly people have. I'm going to, because I talk to them.
Absolutely.
So, let's say I got prostate cancer or I got lung cancer. They still would be able.
Oh, absolutely. The only requirement is if they have end-stage renal disease, if they're getting dialysis right now. The program that they're on now, they're better off staying where they're at now. But there's no pre-existing condition. There's no limitations. 65 and over and on Mass Health standard.
Okay, now I just want to get off the record for a while.
Yeah.
I want you to tell me a little about yourself, where you grew up, what school you went to, where you got your education.
Yeah.
Could you do that?
Absolutely. So I am originally from Colombia, South America.
Yep.
I came to the United States. I was blessed to be brought over here when I was 11 years old.
By the way, I got to interrupt you. You say you come from Colombia?
Yeah.
I love the Colombian music, and I hope I got it right. It's called Kumbaya.
Cumbia.
Cumbia. Yep.
Yeah,
We play that a lot.
There you go. So I landed in East Boston, went to public schools, graduated from East Boston High School. Then I went to UMass Amherst, graduated there.
Good school.
Came back here, and I'm still in East Boston, married. I have 2 children. My daughter is 16. She's a junior in East Boston High School this year.
You got a 16-year-old?
I have a 16-year-old daughter, and I have my son will be 11 in 3 weeks. And he's going to the 6th grade at the Donald McKay in East Boston.
So you must be in your middle 30s then.
Wow, Morris, thank you.
Well,
I wish.
16 and 22, let's say 38?
I turned 43 on Monday. This past Monday, I turned 43.
Gee, I'm twice your age, really.
Yeah.
Exactly twice your age.
Yeah, I turned 43 on Monday. Just celebrated my birthday.
I turned 85 on July 7th.
Happy birthday. Happy belated birthday.
Then we were going to have a birthday party, but nature took a little wrong turn. But tell us about, so you went to the University of Amherst?
Yeah, went to UMass Amherst, and I studied languages and international relations.
What languages besides Spanish?
I also speak Portuguese.
Okay.
Yeah, and I was studying Italian, and when I spoke Italian when I was in college, but have since not practiced it enough to be able to speak it. And I also studied some Russian.
Did you как выпущиваете? You
No,
understand
Papa,
that?
no.
That means how are you in Russian?
Как дела?
How are you?
Yeah,
Right.
yeah. Спасибо.
Thank you.
Yeah. Right,
Okay,
good.
that was a short Russian
Yeah,
conversation.
yeah.
Okay.
Yeah, but Portuguese I still speak, fluent, and obviously Spanish and English.
You know, it's funny when of course, I'm a lot, like I said, I'm twice as old as you, but when I was stationed overseas and in Berlin, at the Unter den Linden, they had the Russian monument. And I used to go by there, and of course they had the Russian soldiers with the guard. And every time I would walk by, they would go, Здравствуйте, Здравствуйте, что это, and I would say, Ничего, Ничего, which meant absolutely nothing.
Yeah,
Right.
no. Yeah. I've been in Russia, an interesting country.
You've been to Russia?
Yeah, I've been to Russia.
Tell us a little. I'd love to hear a little about.
Oh,
My
it's,
mother come from there, by the way.
Really?
From a
Oh,
town called south of Moscow. She said it was about 60 kilometers, called Pushkino.
Okay.
That was the town.
Ah.
Tell us a little. What part of
I
it?
was in Moscow and I was in Penza, which is about south of Moscow, about 600, pretty far.
Did you go
from
visit
Penza.
the Kremlin there?
Yeah, I was in the Kremlin. It was amazing.
What year can I ask you, John?
What, I'm sorry?
How long ago, Ma?
I was there in 2008. 2008.
Oh, so Putin was still the big boy there.
Oh yeah. So it was amazing. I mean, just kind of standing there in Red Square and just kind of seeing being on where all that history happens. Amazing,
Yeah.
beautiful country, really, really beautiful country. Traffic, a lot of traffic.
Yep.
I was, before I went there, I was told there was a lot of traffic, and like I said, it can't be worse than New York or LA, and it was. It really was.
I got to tell you, it's funny because when I was stationed in Berlin, I'm glad we talked about. Can we take a couple of minutes just about a minute, Russia?
Yeah.
They gave credit to Marshal Zhukov and Marshal Konyev, the two Russian marshals that went into Berlin. But there was another one there who never got any credit, but he was in charge of the Russian troops in Berlin, a gentleman by the name of Marshal Timoshenko. And nobody ever heard of him, but really he was one of the heroes of Stalingrad too. So I just wanted to mention his name on there. Because that's where the tide of the Second World War really turned, was in the Battle of Stalingrad.
Yeah. Oh.
So, by the way, what months were you there in Russia? Not in the wintertime, I hope.
I was there, and February. I was there in the month of February.
They say it gets like 40 below.
That winter, or at least that time when I was there, it was actually colder here in Boston than it was in there. Because I called my wife, and here it was a cold, it was really cold that winter. And when I talked to my wife, and it was colder here than there. It was amazing. I was like, I mean, it was cold, but it was colder here in Boston.
So that it was over the Soviet?
10 days I was there, it was much colder here, which is funny.
That's fantastic. What other countries did you visit? Well, besides,
I've been in the Americas for the most part. I've been to a lot of countries in
Argentina.
No, that's one of the few I have not been to. But I've been to
Chile.
I've been to Brazil. I've been to Uruguay. I've been in the Caribbean. I've been I've been
Jamaica.
I've been to Jamaica.
Yeah.
Dominica.
Yep, that was
beautiful country.
Yep.
Beautiful country. Dominican Republic. Puerto Rico. I've been to a few times. So I've traveled in the Americas mostly.
Because Spanish is the second major language now in America.
Yeah.
Yeah.
It's a big, I've read if you take all the Hispanics in the United States that speak Spanish, it's the second largest population,
right?
Besides Mexico. So it's not, you take all the different nationalities and it makes up the second largest
minority
population.
Right.
Mexico's the #1 country, in Spanish speaking, and the U.S. would be #2 if you combine all the different nationalities. So
that's pretty good,
it's
John.
a pretty popular country.
Now I got to ask you. Tell me your early 40s. What are your future plans? What would you like to do in the future, or what are your future plans?
Well, currently I'm running for Register of Probate in Suffolk County.
Good luck to you on that.
Thank you very much. And so I'm all over the Suffolk County. I'm here in Revere, and I'd like to take an opportunity to congratulate and commend really Police Chief Caffarelli and Fire Chief Doherty on the job that they've done with this tragedy that Revere was hit with back on July 28th, and I also want to shout out to Mayor Dan Rizzo of the wonderful job he's done, in leadership and just providing leadership for the people of Revere. I mean, the people are really, lucky and fortunate to have these people out there working for them. So I want to thank them and congratulate them on that job. That community. It's awesome seeing the community kind of come together that quickly. I was. When it happened, I mean, I was obviously in East Boston. I mean, I was, and you see the storm and you see, and
I was right on what I'd like to call Tornado Alley at the Senior Center when it happened around 9:20, somewhere around there.
Where it is, yeah.
And the lights started flickering, and it sounded like a train was roaring outside. And when we looked out, we saw trees down just within about a few seconds.
Yeah.
A few seconds. We had an air conditioner on the roof that blew across to the other house opposite, landed on the truck and did a crushing job. I literally mean a crushing job on it.
It's incredible. You're not used to experiencing things like that. So I was in East Boston. I mean, you hear about it, you see the news, and we saw the storm. It rained. I mean, it was obviously there. You felt it, and then I came by here in Revere and I saw the devastation, the damage. I was like, oh my God, this is.
It's a miracle nobody got killed.
Hurt, nobody got killed. I mean, a couple of people got hurt, but thank God that nobody got killed. It's incredible because some of the houses and some of the things, it's amazing. So thank God that nothing physical, human happened. Property and things like that. The things will come and go, and they'll be taken care of hopefully. But the human life is a big loss.
Exactly.
And no first responders, were hurt or so thank God for that. So I wanted to shout out to them. So that's what I'm doing.
Right, John. I got to tell you, I got about a minute left that I'm going to use up, but I want to thank you to take the time to come down here because I know you're busy, and I got to tell you, you explained that to me, at least to me, beautifully. So I want to thank you again.
I appreciate it for having me. I really, really appreciate it.
And I hope you're around for a long time to do this work, and God bless you for what you do. You're a real veteran of the community, a real veteran of the community.
I appreciate what you do for the community.
And I want to thank the people of Revere for listening.
Thank you.
God bless you. God bless our troops.
God bless our troops and our first responders.
And especially now, the fire chief and the police chief and the fire department, the police department for what they did. And God bless our great country, the United States of America. And John Sepulveda.
There you got it.
I got it right. Thank you for coming, my friend.
Thank you very much, Ron.
And I hope to see you around again.
Thank you. You definitely will. Thank you very much.
My pleasure.